This morning, and joining us is Jim Bahcall, Dr. Jim Bahcall, a former Chicago dentist who now teaches dentistry at Marquette University. And thank you for coming in today. Welcome.
Thank you for having me, Anita.
Now, you are the author of this book, Smile for Life. Why did you write this book?
Well, Anita, believe it or not, 30 to 40 million Americans don't seek regular dental care due to fear. And the reason I wrote the book, Smile for Life, is one, to help these individuals overcome their fear of the dentist, but secondly, to educate people on the importance of good oral health care.
Why are so many people afraid to go to the dentist? What is it about the dentist? Is it a bad experience or what?
Right. Well, I interviewed a number of people for the book, and the number one reason people gave me was the anticipation of pain followed by a previous bad experience. And I should note that the target audience of the book is primarily 35 to 65. These are the people who really have had bad experiences either as a child or as an early teen, and they remember it as an adult.
So how do you help them get over their fear? Is it letting them know what they can expect? Because obviously nobody likes pain.
Well, that's a good question and a good response. As a professor of dentistry, I use education to empower people on the knowledge of what 21st century dentistry is all about. The bottom line is, Anita, this is not your grandparents' dentistry anymore, and it's really the anticipation of an event is much greater than the actual event. And the main thing is, and I tell patients and dental phobics especially, not to wait for exactly
names for that, okay.
Exactly, not to wait for a toothache or advanced gum disease to see the dentist.
Yeah, because then it gets then you find out you really have a lot of work, and it gets very expensive to repair the damage.
Right, and the American Dental Association recommends an average person should be seen by the dentist twice a year, and this is done and developed through scientific studies that show this is the best time period to prevent tooth decay and gum disease from occurring.
Okay, and we'll get to these myths in a moment, but there have been a lot of changes in dentistry. Like you said, it's not your grandfather's dentistry. Talk to us a little bit about the new technology that's out there that helps people get over the pain that they're worried about.
Well, I think the number one thing when people come to the dentist, that sound of the drill, and really there's no correlation between the sound of the drill and pain, but yet we've come a lot farther than we have in the number of years over the high-speed drill. It's now more so an electric speed, high speed per se, and this eliminates most of the noise. We have lasers, we have abrasion, tooth abrasion, small particles that can hit the tooth and remove decay. And the bottom line is that with advancements of technology and procedure, primarily in the area of local pain control with local anesthetics, people can feel very comfortable in seeing their dentist.
Okay, let's go over some of the myths right away. Getting an x-ray by a dentist can cause further problems down the road. Is that true or false?
That's false.
Really?
The bottom line is that x-rays are used by dentists to help determine advanced gum disease and tooth decay below the gum line that they can't see.
Okay, your teeth cannot cause other health problems.
Well, once again, people have this thought that the oral cavity is not attached to the rest of the body, but the bottom line is that if someone who has advanced tooth decay or loss of teeth through advanced gum disease, they're going to have difficulty in chewing their food, which will affect their digestion. Also, 3% of all cancers diagnosed in this country on a yearly basis are oral cancers. And
3%?
Yes, and then also one of the most current research is that advanced gum disease is shown as a marker for cardiac disease, much as the way if an individual smokes. That could be a direct or indirect correlation or a marker for cardiac disease.
Interesting. Okay, myth number 3, that brushing and flossing eliminates bad breath.
Well,
true or false?
I got to split that one, true and false. If you have good daily oral hygiene, you're going to prevent bad breath, or as our term, the jargon, halitosis. But it doesn't preclude somebody from seeing the dentist twice a year to have a professional cleaning and to make sure that the oral cavity is in good condition.
Okay, great. Your book is called Smile for Life, and the proceeds from this book, you were saying, go where?
Correct. The proceeds from the book go to the American Dental Association Foundation for Access to Oral Health Care. Anita, this is a foundation that helps underprivileged people in this country get oral health care.
Wonderful. Dr. Jim Bahcall, thank you so much for coming in today.
Thanks for having me.
Natalie?